Hello everyone, is my sound on? Okay, yeah. Hello everyone, another quick presentation. Treatment of hypothyroidism, another just few slides, or like 15 slides. Some of this will repeat from my other presentation, some will be some new stuff, but I'll try to highlight the stuff that I think is important for testing purposes as usual. Introduction. This is just kind of review for ICM, but basically with hypothyroidism, you need to have thyroid hormone replacement, and that is typically in the form of a pharmaceutical agent known as levothyroxine, which is generic. Brand name of that is Synthroid, and this is synthetic T4 or chemical version of T4. And then hopefully when you treat it and you get the correct dosage, you will alleviate the signs and symptoms of hypothyroidism, or the clinical manifestations of hypothyroidism. Here are some factors that increase the requirement for T4. I believe you've seen these before, but if not, here they are. And you'll notice that sometimes, excuse me, sometimes the hypothyroidism can actually be a transient event and caused by some drugs. So just please note that this can be sometimes a adverse effect or a side effect of a drug. And here are some of those drugs that can cause hypothyroidism. Also note, too, that some drugs can cause hyperthyroidism and that some will cause abnormal thyroid function tests, which I believe you've seen these through. Not a bad idea to read through this list, but don't stress too much about memorizing it. Just please be mindful of the fact that, and for testing purposes, that certain medications can cause hypothyroidism, certain medications can cause hyperthyroidism, and certain medications can cause abnormal thyroid function test. First line drug of choice is going to be your levothyroxine, and I left hyperlinks in here to up to date, so hopefully they still work if you guys want to do that, but don't worry if you don't. Like I said, generic Synthroid, and they make combination products with T4 and T3, and those are not typically recommended first line. And I went through those before in my other presentation as to why, but you can read through here. But yeah, so the majority, vast majority are going to be you're going to be prescribing T4, levothyroxine. This is interesting, and I did mention this before. It is interesting that most medications can be switched with no problem from manufacturer to manufacturer, brand name to generic, etc. But levothyroxine, Synthroid should not be, and if it is, you have to measure the TSH 6 weeks after changing preparations, and to make sure that you still have a therapeutic level of the medication. So yeah, it's one of those things. It's just the way it's made. It's hard to get, even though they are the same strength, it's hard to get the consistency from manufacturer to manufacturer. And then also from brand name to generic. And because of this is one of those medications that some patients may require, or rather not require, they strongly would like to have brand name or brand name only. And that's, it's patient's prerogative. It's up to the patient. So I've had some patients, or say in the pharmacy, that the generic, they have bad side effects with it, or it doesn't work as well, or they need to take a higher dose, etc. But the generic works well for a lot of people, and it's, they don't have problems with it. Just usually, but there is an issue if you switch, as far as it having an effect on their TSH level. Initial dose is about 1.6 micrograms per kilogram per day in young healthy patients. However, older patients should just empirically be started on a lower dose, and I'll go through all the dosages they have here later, but that's typically a 25 to 50 micrograms a day. And this is a medication that should be taken on an empty stomach. So it's usually the first thing that you take in the morning when you wake up, on an empty stomach and before breakfast, and only have it with a plain glass of water. Here are the doses here, so now you can see why I said lower dose in 25 to 50 micrograms, but it goes up to 200 micrograms. And the nice thing about this is there's a lot of different strengths here, and the reason I'm highlighting this is not so that you have to memorize this necessarily for testing purposes, but it is good to know that you can titrate up or titrate down, depending on the TSH level of the patient. With all of these different micrograms that are available, you can really tweak the dose and make a custom dose for your patient. After you first start the person on the, and by the way, sorry, this is brand name Synthroid. So the levothyroxine generic they use the same colors throughout the different manufacturers for these tablets, which is nice. So patients kind of know which colors they take, and that maybe help them if they're taking a couple different strengths or whatever. Other thing to note too, that sometimes patients do have allergies to certain dyes or food coloring, then they can take the white, the 50 micrograms, and you can just do multiples of the 50 micrograms if you come across a patient like that. So anyway, so after you initiate it, you want to go ahead and remeasure, reevaluate in 6 weeks, and then dose adjust as needed. So yeah, based on your lab values. And like I said, with all those different micrograms, you can go up or down pretty easy. Try not to get too crazy with the dosing though. Try to keep it with just maybe a couple different strengths if you're going to do more than one strength. So just because patients get confused, and it'll help reduce errors if you just try to keep it as simple as possible. And so the majority of prescriptions I've filled, it'll just be for one strength. So it'll be like 25 mics, and they'll do like whatever combinations, like take 2 this day, take 1, whatever. Or they'll do a couple different, what I call two colors, but so they'll do 100 micrograms and the 75s, let's say, and they'll do this 100 micrograms Monday, Wednesday, Friday or something. And it just kind of depends on the patient's schedule and what's easy for them to remember. But anyway, so yeah, that is something to take in consideration. Goals of therapy, like I mentioned before, to get rid of the symptoms, and then also to help have the TSH within normal reference range, which I have listed there, but don't worry about memorizing that for my exam. This slide is just more FYI for pharmacology, but there can be an age-related shift towards higher TSH concentrations in older patients. So that's something to be mindful of in your geriatric patients. They make the levothyroxine, or the T4, in a tablet, soft gel, and liquid formulation. The liquid formulation is only available in Italy as of now. Gucci. No, yeah, it's not made by Gucci. It's some other pharmaceutical company, sorry. Just had to have Gucci Tourette's. Got to say that every once in a while. The soft gel is another strategy to go with if the patient cannot handle the tablet or has an adverse effect with, or rather an allergy to some kind of dye or something that's in the tablet, because there's other components that will make the tablet. So sometimes the soft gel can be a remedy for that. And you notice here it says, and this is from Update, either generic, and from the guidelines, generic or brand name formulations are acceptable, unless, I said like before, the patient has a preference or has some past experience with it. And on your prescriptions, just make sure you write brand name necessary or brand name required or something like that, because in the state of Texas, pharmacists, we are allowed to automatically switch from brand name to a generic, so automatic substitutions. And so most of the time we will switch these. If you write Synthroid, we'll just fill levothyroxine. If the good pharmacies will let their patients know if they are switching manufacturers, because sometimes with generics, there's multiple generic companies out there that will make the same medication, and depending on our wholesaler, what price we get or whatever, we'll get different ones in a different months. With the levothyroxine, most pharmacies try to stay consistent just because of the concerns with the TSH adjustments. But so a good pharmacy will let you know that they switched manufacturers and that they need to retest the TSH in 6 weeks after changing, and then document what's going on with that. However, if the pharmacy does not tell you, this could be a reason why a person's TSH maybe is adjusting without any explanation. So the person's been on the same dose for a while, and then all of a sudden their TSH is changing, and they're taking a generic one. They may want to check with the pharmacy to see if they've changed manufacturers or not. I mean, it's, you can also adjust the dose too, and is another potential strategy. I mentioned here that there is the color-coded tablets and with small increments, and so that you can get a really good adjustments with that. The rest of this is just kind of read through. It's not anything too great. Well, the soft gel capsules is an option for patients with suspected poor absorption. If they're, if you feel like they're not absorbing the tablet properly, and then some patients just prefer the capsules over tablets too, if they have any issues swallowing or whatever. But one note, with the soft gel caps, they are a lot more expensive than the tablets, so you may just want to go with a higher dose of the generic tablet, the levothyroxine, then go to the soft gel capsules. The other thing to note too, and is kind of a review from our previous presentation, but adverse effects with levothyroxine are pretty rare. They're not common unless person has like an allergy, or if they're not, responding properly because they're not properly dosed, which is not an adverse effect, by the way. But like I mentioned, if they do have a dye-related allergy or something, they can be given the white 50 microgram tablets. And then here is a summary table, which I believe I've provided you with before, of the thyroid preparations that are available in the US. So we were talking about T4 mainly, so it's going to be the levothyroxine. So there's some different brand names. The Tirosint is the soft gel capsule, and like I said, it's expensive, but that's something you can go with there. An average adult dose is there. So not too much going on in here, just a little bit of extra guidance as far as what to do with your hypothyroid patients, and some pharmacist pearls, if you will, here with this presentation. So thank you guys for your time and attention. I appreciate it. As always, please feel free to email me questions, comments, feedback, whatever you guys want. Hilarious memes that you guys are coming across. No, I'm joking. I shouldn't ask for that, because there were students in the past that would send me memes, and it just got out of control. There was one he was the meme king is what he called himself. But anyways, and so yeah, thank you guys, and I'll talk to you later.